This presentation is going to be on language variation. Specifically, we're going to talk about dialects and accents. Okay, so these are the learner objectives. Excuse my phone. These are the learner objectives. You'll be able to differentiate language or from thought, and or culture, define dialect, describe idiolect, discuss implications of dialect use on social outcomes. So let's start with idiolect. Idiolect, idio meaning that term of the individual, right? Idiosyncratic. So idio reflects an individual's idiosyncratic speech pattern, how one particularly speaks. So you can hear an audio clip of me and you know it's me because of my own individual speech patterns, whether it may be the rate, the manner, my prosody, my voice, my tone, all of those factors that uniquely give me my own language and language style. So speakers of any language possess their own individual idiosyncratic speech patterns, and they help to characterize that person's personality. Quickly, going back to this slide, I want to point out how someone said that language wraps our thoughts. And so if you think of it that way, then you can understand how we use language and communication to shape our ideas. And so naturally, the words that come out and how they come out are going to reflect our unique personalities. So where does language come from? So speaking of that idea that language shapes thought, there's an argument in the literature, a cross-disciplinary argument that, between whether thought does influence language or if language more so influences thought. So, for example, there have been some discussions saying that absolutely not. Thought is only influenced by language and that you can't even think without language. And then there are others that say, well, no, actually, you can think without language. And so I linked a great article here that discusses it in detail. And when you get access to these slides, you can click on it and kind of look through it. And it kind of talks about the language is not thought. Thought is mediated cognition. So mediated cognition, we're going to talk about that right now. So mediated cognition, according to Zlatev and Bloomberg, and that's actually the article. And again, it's hyperlinked in this slide. Sometimes called a higher cognitive process or higher cognitive processes. And basically, mediated cognition is thought, is the act. It is that act of thinking, the thought in and of itself, the product. And so it's a higher level cognitive process. And it's when the mind is not fully immersed in the practical concerns of here and now. So, there are certain things that the mind has to focus on. The mind has to focus on regulating the body, for example, or let's say the brain, because the mind and the brain are two separate things, right? The mind is more of a psychological structure, whereas the brain is an actual organ that functions in your body. And so when we're speaking of the mind, there are still things that the mind has to concern itself with in order to regulate the body in terms of just volition of just breathing. There's just a conscious awareness of understanding what you're doing right now. Now, when we talk about thought, we're talking about how the mind is not fully immersed in the here and now, but is able to think or use structures and processes. That's thinking of conscious awareness, right? That's thinking to focus on intentional objects that are not perceptually present. So that means that you're able to retain an idea about something that is not with you here and now. That is considered thought. In this example. And so they're calling that mediated cognition, which examples of mediated cognition are going to be mental imagery, episodic memories, explicit anticipations, things of that sort. The way you can picture yourself somewhere, for example, or the way you can recall an event or a scene, that's all mediated cognition. And I've provided a link with a little thought bubble for you to click into to dive deeper into professors. I think he's a linguist professor's mediated cognition webpage. So back to where does language come from? So indeed, language may influence thought, right? Thought is not language. Thought is mediated cognition. And mediated cognition, remember I said, is things like episodic memory, for example. And Monkeys can demonstrate mediated cognition. Monkeys can make decisions. Chimpanzees can plan. Chimpanzees can demonstrate cognitive empathy. There are research studies, and they're cited in this article that speak to that. So language does indeed influence thought. Now, we can't say that it does it all the time, because we can demonstrate that thought can exist outside of language. However, we do know that language can elevate thinking, and that thinking does increase with the presence of language, thinking ability, that is. So another point that I want to make here is that language is not culture. I know I've mentioned several times in the course that language and culture are interwoven and reciprocal, and that is highly true. But language is not culture, right? Language shapes and reflects and operates in and out of culture, but it's not culture. Nevertheless, I don't believe that you can disassociate culture from language, and that they're so distinct. I think that they're so highly interwoven that they are separate. But I think drawing the lines between them, is difficult, but it is possible, because if it weren't possible, then they would be one thing. So I don't want to contradict myself and say you can't separate language from culture. You can. Language is not culture, but I do believe that cultural identity is difficult to disassociate from language. I think it's possible as well, but I think the language is such an important part of culture. You have to mention it when you mention culture, but they are still separate and distinct things that have a highly interwoven and reciprocal relationship, to the degree that disassociating them, when you start to speak of individual cultures, becomes a difficult challenge, but it is possible. And we know that because there are cultural norms, there are cultural practices that are unique to cultures that have nothing to do with language whatsoever. So it is possible, but not easy. Okay, so dialects and accents. So now let's get to the nitty gritty. So dialect and accent, they come with very strong connotations. That's in the Smackman book, Discovering Sociolinguistics, and he talks about just the many negative connotations that come with these words and what they actually really mean. So let's explore what they mean. Now, according to Asha, an accent refers to a phonetic trait from a person's original language, that's L1, right? The original language that is carried over a second language, L2, whereas a dialect refers to sets of differences wherever they may occur that make one English speaker's speech different from another. So let's go back to that. An accent refers to a phonetic trait from someone's original language, whereas a dialect refers to sets of differences. So not sets of differences wherever they may occur, but it's not only from one language to another, but within the same language, sets of differences. Uh-oh, that is an alarm. Okay, let's go back to dialects and accents. So the words dialect and accent come with very strong connotations. And in Smackman's book on Discovering Sociolinguistics, he goes into detail about the negative connotations usually that are associated with the terms dialect and accent. And let's start with accent, exploring what this term means, and then exploring again what dialect means. So, according to Asha, an accent refers to a phonetic trait from a person's original language that is carried over a second language. And now, in contrast, they're saying that a dialect refers to sets of differences, wherever they may occur, that make one English speaker's speech different from another. And so that's it. Another's, excuse me. So it's important to mention these sets of difference. So whereas an accent represents a phonetic trait, right? A phonetic trait, a speech sound trait that carries over. Okay, so it's a trait from a language that carries over to a second language, because the two phonetic systems are not direct mirrors of each other. Whenever there are two different phonetic systems, you're going to have an accent unless you can learn to acquire the phonetic system as a native speaker would of the second language that you're learning. So if to help clarify that, what I mean is that an accent is going to be a speech sound trait that is going to hang on to an accent, another language that you're learning, once you're learning that language, because you're still utilizing the phonetic system of your original language instead of adopting the true phonetic system of the language that you're learning. So, for example, if you ever meet a person who speaks Farsi, which is usually associated with people from Iran, a Farsi speaker who's learning English, 9 times out of 10, they're going to have difficulty producing the TH sound, and they're going to mispronounce the TH sound with an F. And it's interesting because it's not like the F associated with the TH substitution that we tend to see in African American English speakers. It's a different type of one. For example, we know that African American English speakers, when they substitute an F, right, they're substituting it for an unvoiced TH. However, that may not necessarily be the case with a Farsi speaker. And so you start to learn that people, and see, African American English speakers, they're speaking a dialect. They're not learning English as a second language. They're speaking English. They're speaking a variation of English, which we'll continue to discuss what that means. But the Farsi speaker is speaking Farsi, which is its own linguistic system, and they're learning a new linguistic system, and they're taking the trait of that original linguistic system, which uses the F sound, and they're using that in place of the TH sound, because the TH sound does not exist in Farsi, so they don't know what to make of it. So they align it, they assimilate it with the phoneme that closely mirrors that TH sound that they know of, which is the F sound in their language. So that's an accent, right? But a dialect, which people often say, your accent, you sound, an accent, again, is a phonetic trait, is not a dialect. A dialect is a set of differences. That's what makes it a linguistic system, because it's a set of differences and it's rule governed. So we'll get more into what makes it rule governed. So think of this: accents refer to pronunciation. People often use it incorrectly, how I was just mentioning, and they'll say, oh, a person's accent is the way that a person speaks, and how they deviate from the norm. But that's not correct. It's just a phonetic, trait. It's a pronunciation. It has nothing to do with how they deviate from the norm, so to speak. It's just a trait. So that's just one thing. I mean, I guess sometimes we can say that, phonetic traits or accents deviate from the norm, whatever that standard English norm may be in your frame of reference. The point is that what is normal, and again, sometimes people can have accents and they don't deviate from the norm. It just sounds different from your normal. So you have to be careful of what the norm means. Okay, so what are dialects? So if that's what an accent is, as I mentioned, a dialect is going to be a language variation. It's a language variety. I like the term language variety that Lisa Green uses in her book, in African American English, an introduction, or a linguistic introduction. I think that's the name of it. I like how she uses the term language variety, because a dialect and a language, they're almost at the same level. They correspond. I mean, there are dialects out there that literally have nothing in common, but they're dialects. And then there are languages out there that overlap tremendously, but they're languages. They're two different languages. For example, I mean, you can take the average Spanish speaker and the average Portuguese speaker. You could put a Spanish speaker in a room full of Portuguese speakers, and you could give that Spanish speaker a questionnaire and an English speaker a questionnaire. 9 times out of 10, that Hispanic with that Spanish speaker is going to understand way more of a conversation in Portuguese than someone who speaks English, because Spanish and Portuguese are highly similar languages, right? Or highly contrastive is what, non-contrastive, right? They don't contrast, whereas English and Spanish are highly contrastive, meaning that they don't share a lot of the same features. And so English and Spanish, for example, an English speaker is not going to understand as much as a Spanish speaker, because English and Portuguese don't have many overlapping tendencies and traits. And so then there are dialects of, in Africa, there are dialects that people speak, and even in Asia, especially in Southeast Asia, that sound like languages. Tagalog, for example, in the Philippines, some people say is a dialect and not really a language. But there are hundreds of dialects in the Philippines that people speak. Even in Ghana, there are tons of dialects in just one little country, and they don't call them languages. They call them dialects. So, you may speak, I think it's called Ho, H-O, and then some people may speak Twi, and then some people may speak Fanti, but these are dialects, not necessarily languages. So again, differentiating between a dialect and a language can be difficult. So it's better to just think of a dialect as a language variety, right? It's a language with a twist, or but we respect it as a language because it's a rule-governed linguistic system. whether you want to view certain languages as dialects or certain dialects as languages. Again, some people think of Haitian Creole as a dialect. Some people think of it as a language, right? Usually when we think of the term Creole, we think of it as a dialect because Creole usually is associated with a mixing of two languages. That's what it means, right? There's a Creole in Sierra Leone. There's a Creole in Haiti or Haiti or however you would pronounce it. There's a patois. Some people consider a Creole. So there are different Creoles. And so we say that sometimes Creoles are dialects, but some people say that they're languages. So again, just think of a dialect as a rule governed system, and therefore it's a language variety. And so we should respect dialects at the level as though they're almost like languages. We shouldn't look at dialects as though they're accents. Dialects are not accents. And that's the major point that I want you to understand from this entire lecture, is that dialects are like languages, and therefore no dialect can be less than another dialect, nor can it be less than a language, because it's at the same level of a language. And so if all dialects are equal, then we have to mutually respect all dialects and languages. And it's not to say that all dialects are necessarily appropriate for certain contexts, but it doesn't also refer to that, one dialect is appropriate or isn't, or one is superior or inferior. It just means that given the circumstances, one may need to code switch, which we'll get into later, or one may need to use a different dialect to better communicate with a certain audience. But that's all that it means. However, when we start talking about dialects such as African American English, which is highly stigmatized, and we get into the features of African American English, which sometimes are attached with social stigmas that make the dialect seem as though it is less than, you have to keep in mind that it isn't. And if you don't keep this in mind, it can affect you in the way that you work with African Americans, or especially African American English speakers in different contexts, as a speech language pathologist. Maybe if you decide not to be a speech language pathologist, as an educator, or whatever profession you choose, because you might hold some negative bias against the dialect that you're not allowing yourself time to really understand, because you're not respecting it as such. So keep in mind, AAE is a dialect, and a dialect is a language variety, and a language variety is a variety of a language, which means that dialects and languages are essentially equivalent. Okay, so more on dialects, just more facts that languages, like dialects, change over time. What does that mean? That means they're dynamic. And I think we discussed this long ago when we talked about what language is and the structure of language, that language is dynamic and that people tend to use the same language norms, but it evolves over time. So people who live in the same area or identify with the same social identity will almost always usually speak the same dialect. So that means that dialects are mutually intelligible forms of languages associated with particular people, right? Because if I'm from a same particular social class, region, social group, ethnic group, then you and I should be able to mutually understand each other when we use certain terms that are associated with our groups, right? So again, they're often referred to as accents, but they're not the same. So ASHA has a position on social dialects, in case you didn't know. And in case you were unaware, ASHA is the American Speech Language Hearing Association. And back in the 1960s, people from Howard University protested. People like Orlando Taylor, Kay Payne, even more people, Joan Payne protested, especially in the neuro area. And she published the first book on neurogenic speech and language issues in the African American, particularly in the multicultural communities. But there were so many other people, the champions in our profession, who many of them are on the wall of fame when you walk into our department. These people advocated for rights of professionals in the discipline to be able to fairly treat, assess, and practice and uphold practice standards that were culturally and linguistically significant and relevant to the people that they served. They found that so much mistreatment and misconduct was being allowed with how professionals were dealing with minorities. And so they made a major goal to minimize that by advocating for better research standards, better ethical practice standards in the profession. And it started, it took a long time. It started in the 1960s during the civil rights era. And as you can see, this position on social dialects is in 1983. I think that they did have position statements prior to that. And I think this was a recent revision, but I'm not sure. Nevertheless, it took Asha a while to really warm up to the idea that Asha was being very racist and discriminating against minorities in how we were diagnosing and treating, especially Black patients at the time. So Ash has come a long way, but as you can see, if you look in our profession, it's 90 something percent white, and there's a very, very small percentage of African American speech language pathologists and audiologists. I mean, it's almost minuscule, and we don't make up a huge chunk of the profession. And if you notice the materials, the content, the journal articles, everything, if you Google it, it's very white. And not that it's bad, but we still have a long way to go with regard to finding solutions that address the needs of the patients that we serve from the diverse backgrounds in which they come. So Ash's position on social dialects is that no dialectal variety of English is a disorder or pathological form of speech or language, and they provide desired competency in standard American English without jeopardizing the integrity of the first person's dialect. They're basically saying that every social dialect, and they're saying social dialects, meaning the dialects relating to social groups, not necessarily regional groups or age groups or any other group, is an adequate variety of English. And they were saying so, again, because many speech and language pathologists, and you saw from this dialect module, and many educators were basically saying that African American English, or at the time they were referring to it as Ebonics, is a lesser than form of language that should not be utilized in schools because it leads to children becoming ignorant and never developing the communication skills that they need for use in standard English. And there was the debate about, well, children learn from their natural language environment. And so if you take that away from them, how will you help them to learn standard English? How will you bridge the gap? Wouldn't it be better to teach them in their natural language and give them the opportunity to cultivate standard English skills in a different way? And that's the argument that was going on in that C-SPAN video. All right, so the Center for Applied Linguistics provides information on what a dialect is. So when you have a chance, you can check out this webpage, just Google Center for Applied Linguistics and Dialects, and it'll pop you up on this dialect page, which right here is what you'll see. Also, students and professionals who speak English with accents and non-standard dialects, issues and recommendations. This is a technical report by Asha. I'm going to link this report in your document in Blackboard, and I would like for you to take a look at this report and see how programs were actually penalizing students for not speaking standard American English to the degree that Asha actually had to make a report on it. So take a moment and think about that, and think about whether or not you feel like you speak a dialect, and if you will be penalized if you were in a different program or a program that adhere to use of standard American English, and think about whether or not you think that that is fair for African American English speakers or students from other backgrounds, or how it could maybe benefit the profession because we have professionals only using one dialect. So take a position, take a stance on that, and I'm going to ask you about that later on in this module. So more on that. Again, this is more information on dialects of student SLP clinicians. So again, I'm linking in the report here. I want you to take a look at the report and consider those considerations that they have, as they mentioned, student clinicians who use non-standard dialects and how that affects the communication skills of the student clinician in the therapeutic context. And take a stance on it. Let me know, do you think that this is accurate, that they're on the right track here with this report? Do you agree with them, or do you disagree, and why? And give an example to support or refute your answer. All right, so again, I'm looking forward to hearing your responses. Thanks. More information here on dialects, referencing the report. And again, I just wanted to point out that dialects, again, have their own unique linguistic characteristics at all levels of language, for phonological, morphological, syntactical, etc. And so in a separate lecture, we're going to discuss African American English, but I think that's pretty much sufficient right now. Again, I wanted to provide you guys with more content on the issues about dialect use in student clinicians. Again, this is a major issue in our profession, where many people in the profession, especially from schools in mainstream settings, universities and mainstream settings with academic programs for speech language pathologists, they're claiming that students from different dialects, particularly non-mainstream English speakers, such as African American English speakers, are unable to write reports, or are unable to pass tests, or are unable to demonstrate clinical competency, or to provide articulation therapy because they may have certain cultural linguistic mispronunciations or deviations from the standard English that suggest that they wouldn't be able to teach a speech sound to a standard English speaker. So I want you to sit with that and really think about that as you develop your response to my question to you, which again is, how do you feel Ash's approach is in that technical report about students being able to use dialects, particularly non-mainstream English speakers, who don't speak standard English, basically. Are you saying that these students who don't speak standard English should not be allowed to enroll in and remain in CSD programs because of the requirements for them to be able to use standard English to write clinical reports, to communicate with clients, and to provide therapy and treatment? Or are you saying that you don't necessarily need to be able to speak standard American English to be a speech language pathologist? And so do you believe that clinical report writing is related to your ability in dialect use, to the degree that if you speak a dialect, you wouldn't be able to write a report? And if you speak a dialect, you wouldn't be able to provide therapy? And if you speak a dialect, you wouldn't be able to necessarily communicate effectively with clients in a professional manner? Do you agree that it is best to keep the dialect outside of the clinical setting altogether? So what's your stance on that? I want to hear, and I'm looking forward to it. All right, I'm going to end this module here, or this lecture here.